So to understand more about the function that smoking was having for Jane, we did what is a really important part of all behavior therapies, and that's doing a clinical functional behavioral analysis. And so the way I presented that to Jane was, we're going to learn the ABCs of your smoking. We're going to learn what triggers it, which is A, or antecedent. We're going to learn about the behavior, in which case it's smoking. And we're going to learn about the consequences. And consequences can range in many different ways, and I'm going to talk about what those actually mean. Now, with Jane, I just had her track on a little paper log, and you could do this on a tracking app. You can do this on a log. There's a lot of simple ways to track ABCs. We did some tracking just in a session so I could teach her how to track the ABCs. And then for 7 days, she was going to track the triggers, the behaviors, and the consequences. So what did that really entail? Well, first was to look at what are the situations that triggered her to smoke. Now, of course, our eyes look outward. So the easiest tracking we can do is looking at what are we doing, what's around us, what do we see with our eyes. And so for her, that was after an argument, it was while she was at home, it was when she had something to drink, such as coffee or a drink of beer in the evening. It was while driving, it was while watching television. And those are very common situational triggers for smoking. The second one I had her look at was inside. So it's always easy to start the outside, but then was trying to look inside. And there, I had her start focusing on what emotions she noticed before she would light up a cigarette. And so she identified it was feeling anxious, particularly socially anxious. It was feeling tired, and it was feeling angry. Now, of course, this can range when you're assessing the types of emotional triggers for smoking. It can be the more positive emotions like joy or happiness or euphoria, pride, but also the negative emotions. So loneliness, anxiety, sadness, anger, things like that. And then the third class of triggers I had her look at were the physical sensations. And for her, she felt a sensation in her chest, in her throat, and in her hands as being important physical triggers for having a cigarette. Other common places that I have seen over the years is that people feel a sensation in their stomach or in their mouth. And so you can look at a variety of places where learning about what is it that's physically triggering someone to smoke. This is often because nicotine, you're having a physical addiction to the substance. It's often a physical sensation that's an important, immediate antecedent. So, of course, the behavior is smoking. So I just had her track when in the day it was that she had a cigarette. And then the last part is the C, the consequences. And so what we learned was many of those physical sensations and emotions were reduced. They were immediately reduced after having a cigarette. So that sensation in her chest, that sensation in her throat, in her hands would reduce. Didn't go away completely, but it reduced dramatically. The feelings of anxiety went down and the feelings of anger went down. And she felt a little bit more alert, so she felt a little less tired. So this is a very important thing to notice. And it's an important thing when you're giving feedback to the client, just like I did to Jane, is that quick response that you get from the cigarette, that it reduces something aversive. You're reducing that feeling of fatigue, of anger, that sensation in the chest. The fact that it's so rapid is what makes smoking so effective. It's a negative reinforcer in the language of behaviorism. And so that was really a key learning that we focused on by about session 3. Of course, there are longer-term consequences to smoking, and many of those we've touched on in our assessment. And that the most important one for her was the blurry vision. And of course, there are even longer term consequences. She would be at risk of severe complications from her diabetes, heart disease, and multiple cancers. Those, of course, are a longer time horizon. They can be 15, 20, 25 years out, but they're very important to bring and help a client stay aware of, as I did with Jane, is that you're doing something now by quitting smoking because you are going to be able to prolong your life, prevent great suffering from these severe cardiovascular and other diseases that can occur from continuing to smoke.